Hello everyone, this is Claire at StudentRDH and we're going to start our webinar very soon. So first of all, Happy New Year. Thank you all for being here today. And we have a lot to cover, so I'm sure you guys are all really excited. Oh, you cannot hear me. Okay, let me see. All right, so now in the chat, can you tell me if you can hear me? Can you hear me or not? Yes, okay, great, great. So before we start, I'm gonna ask everybody to mute yourself. You should have a little button. For me, it is at the bottom. For you, depending on your computer, it might be on a certain corner. But if you find that mute button, that would be the best because that would help you, that would help us having a better audio quality, okay? So let me know if you have problem with that. So we have about 73 of you joined already. And I'm assuming that a few more of you will join within the next few minutes. So we had hundreds of you who signed up to learn about the NBDHE. Now I'm gonna ask you, since we are on the chat, which school are you going to? Which school are you going to and where are you from? So we have Remington in Nashville, Seattle Central, New Hampshire, Eastern, that's New Jersey. We have Valencia, Fortis, Eastern, Normandale, Louisville, West LA, Shoreline, Taft. Wow. Pueblo, we have Northeast Mississippi, Pierce College, Miami, Bergen, Pennsylvania. Oh my God, guys, all of you are here today. This is amazing. We probably have almost every single state here, right? So I'm gonna ask you guys now, I'm just waiting for a few more students to come in. We are about 80 of us now. If you have registered for a board review, whether it's StudentRDH, whether it's Andy, whether it's J seminars, you can tell me honestly, I just have a kind of an understanding who is in the room to understand what kind of content that I have to provide. So if you are with a certain school, certain boards review, you can tell me, and then, you know, I'll try to not repeat certain information or things like that. So if you have a boards review, thank you, Bluely, for saying you have StudentRDH. And tell me, did you sign up for something? KK, thank you for saying you're only with StudentRDH. And Kathleen as well. Rachel saying that you have the Mosby book in StudentRDH. Mosby is great as well. Anthony saying you are at which DH seminars. Can you tell me, Anthony, which school you are going to? And again, I'm just trying to collect this information to understand how I can tailor this 1 hour webinar so I can give you the most. Oh, okay, Anthony, you are with Eastern International College, great. I'm probably gonna present to you a webinar very soon as well. Okay, so Darby KK is a great book. It's a lot, it's very heavy. There's a lot of pages. It's a lot of information. So that was my idea when I created StudentRDH, to really condense information to really what we need to know. And also even the sentences, I made them simple. Who needs to read big sentences like in the textbook? So we can save our time. So everything has been very well organized in StudentRDH. That was the whole point from the beginning, because I have been there with you. I was in your shoes actually about 6-7 years ago, okay? Carrie, you're saying you're with NDRDH, so you weren't exactly successful. Now you're studying with StudentRDH. Well, Carrie, if you need extra support from me, I am here, okay? I don't leave our students just to fail. If you have questions, email me all the time. We have some Q&A sessions every month as well. So anything you need, you know, I'm here, okay? We also have some students who did some sort of live boards review, and we didn't exactly feel that that was compatible with them. Maybe the 3-day event, it was too much to pack everything in the brain, which is true. I don't understand how we can do that in 3 days, but you know, I want you to make a better sequence of study. Now, thank you everybody for being here. We have Claudia, Laura, Chelsea, Lydia, so many of you here from more than probably half of the country, about 100 students right now. So I'm gonna start my presentation. It's gonna be 1 hour about how everything we need to know about the NBDHE. because the new guideline have been updated. Anybody read the new guideline for, oh, is that hard? Is it too hard for everybody to hear me? If so, let me know so that I can go to a different room. Do you think it's, okay, so some people have problem hearing me. Some people saying I am okay. So guys, I'm going to continue. This is recorded as well, just in case you missed something. You can replay it, okay? I can choose a different room, but let's continue here. So the 2020 guideline has been updated for the NBDHE. Anybody read this 2020 guideline? No, we have some no, we have some yes. A lot of you say no. So that's great, because today I'm going to summarize that for you so you don't have to worry about reading the whole thing. I'm going to give you exactly what you need to know about the NVDHE. All right. So let's start. I'm going to share my screen and you will actually see my presentation. So it is here. Now, can you tell me if you can see my PowerPoint presentation? Can you start seeing it? Okay, perfect. All right, so we're gonna start this with this presentation, and I'm gonna rewind to the very, very front. I don't know why I started here. So welcome everybody. We are here in the webinar that is about everything you have to know about the NBDHE. NBDHE is the American exam, the national board exam you have to pass no matter where you are in the US, because that is the one exam that stands between you graduating and actually getting this RDH license. Everybody has to go through that. We have over 15,000 success stories at StudentRDH, and I'm sure you will pass as well. But in order to pass, we have to do a few things, which is understanding your opponent. So if NBDHE is the opponent, you have to understand what it is composed of, what questions you're going to see, how much time you're going to have. So you need to be as detailed as possible in getting all this information so you can tackle it with the right strategy. So let's continue. So here you have the NBDHE, everything you have to know. And then this is StudentRDH. We have over 99.5% success rate. This is not trying to me bragging about myself. It's my sister who is a dentist and myself who is a dental hygienist who created it, because I was in your shoes. I had the pain of trying to pass the board examination. There were some live options that were too expensive for me because I had to drive there in the snow, or I had to pay for the hotels. And also I wanted to study on my own home. I didn't find anything that was quite as compact as I wanted to be. I had Mosby, Darby, everything that you think when you have to prepare for the board examination. They were just so heavy. I didn't even want to have it in my backpack. I didn't even want to study with them because it was just overwhelming. So this is what we created. And today is not about StudentRDH. It's really just a summary of everything you have to know about the NBDHE. Now, this is a quick story about Sarah. I don't know if you've been to my other webinar, but I love her story because it's so impactful. It's so encouraging. She failed twice and then she passed the third time. Well, it was days before her wedding. She was had a lot of stress. She graduated from West Virginia University and she studied a lot. She was a great student. She was had a wonderful personality. But what was missing to me was a little bit of that strategy. It's not just about how you study, it's about how you prepare, because you know what is going to happen. It's like running a marathon. If you don't know what marathon you're going to run, it's a little harder. You can be a great runner, but let's say New York, not that I've ever run a marathon, but sometimes you have bridges, you have hills. If you don't prepare yourself for those conditions, it is going to be hard for you to cross the finish line on time. So today we're going to look at those things. New updates, scope of exam, how you're going to get results, what kind of time do you have, what is the schedule like in your boards, what question types you're going to see, if you can reschedule, and I'm going to give you some other tips of how to prepare. Does that sound good to everybody? If there is something you are missing from here that you do not get from me, please use the chat to put your answer, okay, your question, and I will answer them. All right, so let's start here with the new updates. Does anybody know what happened to the Perio guideline? What did your school tell you? Did the school tell you you're going to use your new guideline, the 2019 guideline, or you're going to use the old guideline, the 1999 guideline? So I know that we have a very conflicting answers here. We have old, new, both. Okay, so here it is. I'll give you the answer. This is straight from the NBDHE. Okay, I didn't make this up. This is straight from their guideline. As you can see, in their words, I didn't even reword it. They said in 2017, the American Academy of Periodontology introduced new classifications. This new classification will be implemented in the fall of 2020 for the NBDHE. Now, does that solve your problem? Let me know if that clarifies. That means right now we are not using the new one yet. In the fall, which is going to be probably around, I would say, August and September, you will see the new guideline. That means right now, so right now we are in January 2020, you will still see the old guideline. Now, if you see some questions that are with the new guideline, guys, you have to know that there's some dummy questions in the board examination. They might not necessarily be there to for you to score. There are some dummy questions. They don't tell you what it is, but there are some in the board examinations. So what you might see is actually a dummy question. So don't freak out. But according to their guideline, line by line, word by word, it says that they're going to use the old, well, they didn't say they're going to use the old classification, but they said that they're going to use the new classification in the fall. So who is taking their board in the spring? Who is taking their board between now and May? Great, we have Megan, we have Ali, we have Chris, Maddie, Alicia, Brenda, iPhone, we have Mel. Oh, hi Mel, I think I saw you in the other webinar, right? Okay, Fontana, thank you everybody. So Leanne, so you're gonna take the boards within the next 5 months, and I would say stick to the old classification. Now, StudentRDH is following exactly the guideline, right? So if you are with StudentRDH, you can see right now we are still using the old classifications, not because we've been lazy, it's because we are waiting for the right time to make the switch. Because if we make the switch too early, you won't have things that you actually need for the board examination. So actually StudentRDH will update their guidelines again, will update their questions around May or June 2020, so we can reflect those new updates. Does that sound good? Anybody taking the boards after May? And Mel, you said third time is the charm. Let's get you ready, okay? Okay, so we have Michelle, Mind, MND, Jill, Amy, okay, 2020. So if you are one of those students who are taking it later, then know that you have to stick with the new guidelines, okay? Is everything clear about this right now? Okay, all right, so now we have clarified this issue. Well, when it comes to the new guideline, there are quite some changes. First, this is the old guideline on the left side, which we use at StudentRDH. But the big difference between the new and old guidelines, for me to summarize, is that before they had aggressive and chronic periodontitis being separate. Now they said, okay, well, it's all periodontitis. It's hard to make a distinction. Therefore, now it's just called periodontitis. And instead of being slight, moderate, and severe, they have different type of staging, okay? So that makes actually everybody's life easier. Stage 1, 2, 3, and 4, as you can understand, some are more severe than others. And then they looked at the whole mouth and they say sometimes this area of the mouth can be like that, and then this other area of the mouth can have a different diagnosis, right? A different stage. So they introduced that as well. And then the new classification include things such as severity, does the patient has a disease, how fast is the disease progressing, and what are the risk factors such as smoking, you know. We are thinking about all of those things, including the patient's overall health into understanding the patient's perinatal status. So those are the big changes, but again, I will update you on this after the spring so that we can be ready for the fall 2020. All right, so I hear someone, can you mute your microphone, please? It's hard for me to detect who that is, but please, if you have an option to mute yourself, please do so. That would help everybody have a clearer audio. All right, so now blood pressure guideline. Do you know what happened with this, right? Now it's been a while since they had the new guidelines. And the new guideline is going to be the one they use. This is literally a screenshot of the NBDHE. It says the NBDHE as it is administered in 2020 reflects the 2017 guideline, meaning the new guideline. So at StudentRDH, we just worked on reflecting that specific guideline. So you're going to see some changes within the next few days, but for the most part, everything has been updated. So you study with the new guideline. Now we still have a little section that talks about the old guideline just because some schools still are using that. And some private practices are still using the old guideline. It just shows you what it is, but the correct answer would be according to the new guidelines now. All right, Sharon, you're asking, you haven't started periodontics course yet. So are you using the old classification? So in StudentRDH, we use exactly what the board guideline says. Right now, we still use the old one, but for our students who are preparing for the fall examination, we will change that around June time so you can be ready with the new guideline. Does that make sense? Great, Sharon. Perfect. Now let's talk about the scope of examination. I mean, what are they going to ask you in the examination? That's a big mystery, right? What do I have to study? Is it going to be about dental anatomy, periodontology, anything? It can be anything. But here, this is some of the screenshots that sorry. Before I talk about that, let's talk about this. How many questions are there in the board examination? Do you know that? Can anybody answer that? 350, Cameron, Anthony, no, you have found the answer already from our friends, Morgan, Sharon, Kim, Angelica, who are shouting the answer. So that's 350 question grade. What about sections? How many sections are there? Do you know how many sections? Sharon says 2. Anybody else who wants to have a guess? All right, so it seems like Kim, you're not sure, 3 maybe? That's what you're saying on the chat. Okay, Leon says 2, Rachel says 13, 11. Okay, so the answer is 2. So okay, there are 2 main sections. As you can see at the bottom, 200 question, which is discipline-based component, and 150 question on case-based item. So those are divided into 2 different sections. As you can see, I color-coded them. And then lastly, I want you to just understand how much time do you have. Do you know how much time in total? How long it is? Cameron says 9 hours. Rachel says, well, Rachel, you are correct. If you're thinking about subcategory, there are more. So we're going to discover that together, okay? Erin 8.5 at 5 hours. So the answer is 9 hours. That's maybe some of you say 8.5 because there's some optional sections such as breaks and such as practice questions and survey at the end. So the answer would be 350, 2, and 8, you know, depending on whether you want to count the breaks or not. Here, I did not count the optional breaks. That's why I say 8, but it can be 9 as well. All right, so here we have session 1, and I'm going to show you a quick video of what session 1 looks like. So session 1 is really more like, they call it discipline-based, but that means like the questions are more simple. It asks you something that you know already from your textbook, and it doesn't exactly require you to like put all this information together and take a guess. That is case study. So this is more straightforward. So this is session 1, and I took a little video from StudentRDH because obviously I cannot go to the NBDHE and take their screenshot. So I'll tell you exactly what happens with StudentRDH. This is our mock exam. You have exactly the same amount of time as you can see over there. Is the time is countdown timer. and then you can click your answer, and then you'll be able to submit it. Now, you can also check your answer at StudentRDH because it is a practice. However, you can't do that with the board examination. Now, if you see flag function that you will have in your board examination, that means you want to go back later, right? At StudentRDH, we have the flag function that is a little red tape. So when you see the summary on the left side, which you will have a summary also at in the board examination, you'll be able to see which one that I want to go back to. So this is how the basic, the first session will run. Any questions on that? And I have a question about learning disability. So I heard from other students who requested a disability kind of testing center. They had 2 days instead of 1. Okay, so I will double check the answer for you, but that's what students have told me so far. So any questions right now on session 1? You just seen the video. This is StudentRDH, and this is how the exam rolls. You have a timer, countdown timer, and then you'll be able to select your answer. All right, so I feel like everybody got this. There are 200 questions in session 1 in total, but that is divided into 1-1 and 1-2. I call them 1-1 and 1-2. They call it something a little different, but for simplicity, I call them 1-1 and 1-2 at StudentRDH. And you will see StudentRDH that it is composed, the mock exam is composed exactly, and you will see it in the board examination. Okay. So Morgan, you say, yeah, that's my understanding as well. And you will be given a 2-day exam. And that's what I understand too, okay? So thanks for checking with us, and thanks for answering, Morgan. Now, this is session 1. Now, you might wonder, well, what's in session 1? Because, you know, they were about 17 or 20 classes you took during your school years. Well, I have to study all of those. And as you can see here, so there will be 150 questions on, they call it provision of dental hygiene services. Means you're going to obtain radiograph, the technique principles that's within, they call it the provision of dental hygiene services. What about infection control? That also is in the provision of dental hygiene services. What about performing periodontal procedures, scaling and root planing, which instruments are going to use? That is also under provision of dental hygiene services. What about fluoride? You know, pits and sealant fissure. Pits and fissure sealants. And then what about ethics? So all of those are under provision of dental hygiene services. Now that's 150 questions. To me, this guideline is good. It gives you kind of an overview of what will happen, but that's not enough because it literally said head and neck examination. That's it, your entire textbook of head and neck anatomy, right? I mean, that's a lot. How are we supposed to know what in head and neck we're supposed to study? So this guideline is okay, but obviously they can't tell you exactly what is going to happen. That beats the purpose of actually having an examination. But in my personal opinion, it's very vague. That's why it's hard for all the students to study because they just don't know what to do. From here, they're like, okay, now what does that mean? What textbook do I get, or what board review do I get? Do I need to read from front to back? Do I need to reread my 20 textbook that I had? So that's why StudentRDH, we really compress everything that you have to know in the best format that you can also use on the phone and on the computer. And we're really not chipping out on the content at all because we have the quizzes, you have all the study notes that you need without having to read through the big textbook, and you have the full mock exam so you can have the timer, the real question experience. Now, let's continue. You have a scientific basis for dental hygiene that includes anatomy, physiology, nutrition, pathology, pharmacology. Now, great, right? What does that even mean? There's so much. And then lastly, there are some community oral health questions. Right? So the community oral health questions is 24 items. 24 items that is going to be about a case scenario. You're going to have a case that asks you, the patients are in this kind of community, you go in as a hygienist, maybe you do the DMFT score, things like that, and then you have to assess a few things. So there will be questions following each case study. StudentRDH, we have exactly that same format as well. I'm going to perform you a little bit of calculation over here, okay? So there are about 17 chapters that you have to study that are available at StudentRDH. Every board review have a different style. I like to make it like, I like to make them smaller so that you're not overwhelmed with the big, you know, let's say scientific dental hygiene. Then that's like a lot, right? So we have broken them down into about 17 little chapters. Now, 17 chapters, community health is one of them. But community health is 24 questions. There are 200 questions in session 1. So let me do this for you. There are 24 questions. Can you see my phone right now? Can you see my calculation? Okay, so 24, I'm going to divide that by 200. Okay, that's 0.12, and I'm going to multiply by 100 just to have 12%. So 12% of session 1 is community oral health. Okay, so this is just my phone. I just did some simple calculation. Now let's do the math together, guys. There are 12% of community oral health in session 1. There are 17 chapters, and then community is one of them. So how many other chapters do you have left? If you take out community oral health from the 17, how many chapters do you have left? 16. Thank you, Angela. All right, simple math, right? With 16 chapters left. Now, community oral health was 12%. What is the percentage of the rest of the examination in session 1? So that's 88, right? You have 88% left with the rest of the 16 chapters. Okay, so this gives me a math that each chapter is about 5% of the examination, while community oral health is 12% of session 1. What do you think I'm trying to say here? I'm trying to tell you that community oral health is extremely, extremely important. Okay, so go to that chapter, study it a lot, because you're going to have about 12%, while other chapters, even oral pathology, might be only 5%. Now, this is only session 1, okay? Because session 2 is different. It's all about case studies. It's going to be concentrated on pharmacology, oral pathology, periodontology, and radiograph, okay? So that's different, but we reviewed right now session 1 together. Any questions on session 1? We have 200 questions over here. Everybody good here? Okay. Now let's continue. You probably wonder what session 2 looks like then, right? So instead of me talking about it, this is another video that I took. This is a screenshot of StudentRDH. As you can see, you have 4 different tabs, right? Radiograph, photograph, chart, and patient profile, and which each question you will have to select your answer, and you will have to continue with that specific case. So each case, there are about 12 to 15 cases, and each case will have about 10 questions, give and take, because as you can see, some cases are longer than others. So this is, again, a video that I took from StudentRDH, because obviously I cannot go to the board examination and be able to take this video. Now, as you can see, some questions we will update because now we have the new guideline. We are January 2nd. The new guideline has just been released. So we will be up to date at StudentRDH. And you continue that. Now, you have 150 questions with that, okay? 150 questions. And there are about 15 cases with different charts, history, radiograph, and photograph. Any questions related to session 2? Okay, seems like you guys are all doing great. You are following. All right, so let's continue with our presentation with what kind of questions are you going to see with the NBDHE? Okay, so Heather is asking, can we practice the case study questions other than doing the full mock exam? So Heather, you are asking if you can just take the case study questions out of the full mock exam? I just want a little bit clarification, Heather, and I'll be able to, okay, great. So what we have as StudentRDH is that the mock exam includes a full case studies. However, in each chapter, let's say oral pathology, you will have your own set of questions that can include some photograph or radiograph. For example, that is kind of a component of the case study. But the case study, like bundled together, you have to find them in the mock examination. Thank you for asking that. Now, questions type. First of all, the first question type you'll see is completion. Now, there were more, and we just read the board examination new guideline, and they took out some things. Luckily, you left with only 3 type of questions. The first one is completion. As you can see, let's do it together. The cluster of sebaceous glands observed on the buccal mucosa is, and then you have answer choices. What do you think the answer is? Let's do it together. Okay, you guys are great. C. Oh, is it easy for you? Okay, perfect. So this is oral pathology. And C is the answer. It is kind of yellow. You will see some marks on the buccal mucosa. So that is completion. It's very simple, right? Something, something is, and then you complete the sentence. Okay. So now we have the question type, which is something, something, question mark. For example, this one, which type of hypersensitivity has the most delayed response? And which do you think is the answer? Which one of them? While you think I'm going to answer Carrie, Carrie's asking, I'm taking the NBDHE end of this month in January. Did you say the old or new payroll guideline? Carrie, the answer is the old guideline because the NBDHE guideline said they're going to implement it in the fall. Okay? All right, so we have some answers coming in over here. And all right, so the correct answer here is D. That is great. You guys are really, really smart. Okay. So this is how I remember it with wake up memory that we have as StudentRDH. So I think to myself, I'm trying to relate to something that I know 1, 2, 3, and 4, because there are many different 1, 2, 3, and 4 that you're going to see. For example, in community oral health, you have, type 4 observation. What does that mean? Type 3. So here, what we're talking about hypersensitivity, I think about the response being 1 second, 2 minutes, 3 hours, and 4 days. Again, 1 second, 2 minutes, 3 hours, and 4 days. Which one of you do you think is the longest, is the most delayed? Obviously, 4 days, right? 4 days. So that is hypersensitive, that is most delayed. If you think about anaphylaxis, that's immediate, that puts the patient in danger of death. That is type 1 because it takes seconds to arrive. Make sense now? Okay, let's continue. We have one more question type, and someone up here said negative question. True or false is, well, different than this, but this one negative is something, something except, or something, something false. Did anybody had problems with this type of question when they were at school? You know, you go to a professor and say, I thought I had this correct, but when you look at it, you're like, oh, I made a mistake, right? So Sharon, you're saying me, Kelly, Angela, Anthony, thanks everybody for being honest here, Alexis, about that you have difficulty with this type. So we're gonna do this together, guys, okay? So we're gonna play the true and false game, okay? Think of it as a game, nothing else, a game. Let's do it together. The conditions, okay, are contraindicated for nitrous oxide, except. As soon as you see this word, except, false, don't panic, guys. Say, I'm going to play the true and false game. So you think, okay, so the condition is contraindicated for nitrous oxide. Let's say A, COPD is contraindicated for nitrous oxide. True or false? Right? Okay, we have some T, true coming in. COPD is a disease of the lung. The lung do not perform as they should. So when you provide nitrous oxide, the patient is not going to do well with that, right? Okay, so true, great. Asthma is contraindicated for nitrous oxide. Is it true or is it false? It's true. Okay, a lot of you say true, some say false. Okay, so we have kind of mixed messages here. So let's continue. Cystic fibrosis is contraindicated for nitrous oxide. Is that true or is that false? Cystic fibrosis. Okay, we have some mixed answer over here as well that are true and false, okay? Well, cystic fibrosis is a genetic order, okay, of the lungs. Okay, it can also go in the pancreas and other parts of the body, but basically the patient cannot breathe properly. It's having a lot of difficulty and it's there, it's chronic, it's constantly there, it's a genetic condition. So, Last one, pregnancy. Is this contraindicated for nitrous oxide? True or false? All right, everybody says true here, so there's no doubt. So we're left between B and C. The correct answer here is asthma. Okay, actually, a patient with asthma can benefit from nitrous oxide because it relaxes them. Patient with asthma, unless it's really severe and chronic, they can still exchange gases. Cystic fibrosis is a lot more severe condition than asthma. So here, the answer is asthma. So we play the true and false game here. And then we said, okay, asthma is false. So you find something that is false, okay? So let's do one more example because I know this type of question is very difficult. So let's do it together. Something, except. So then you have an exception. You just play this game again. A, root planning strokes employ lateral pressure. Yes or no? True or false? We have answers coming in. That's great. Okay, root planning strokes have lighter lateral pressure. True or false? Now B, root planning strokes are shorter. True or false? Okay, so we have mixed answer here. That's why I'm not saying anything. We have mixed answer. C, root planning strokes should overlap previous stroke. Is that true or is that false? That's true. Here, everybody's saying true, okay? Root planning strokes employ a lighter grasp. Yes or no? True or false? So everybody says true. Okay, we're between A and B then. And the answer here is B. So root planning, when we're talking about the roots, they are a lot more fragile than the enamel. Enamel is the hardest tissue in your body. So when you're dealing with the root, though, it doesn't have the enamel coating. Therefore, you have to have a lighter graft, or not you can take a whole lot of cementum and root surfaces while you're just trying to help the patient be in a healthier state. So we don't want to take out too much. So if they're shorter strokes are usually when you have heavy calculus, you do shorter, more forceful strokes. So root planning needs longer strokes. So that would be the answer, guys. So thanks for participating in this game of true or false. Is that a little easier for you to do now when you see something except or false? Can you play this game now? Thank you very much, everybody, for saying that this is helpful. Kelly, Morgan, Chris, and everybody. All right, now let's talk about community oral health. So we have 3 types of questions. Can you repeat them, what they were? So they were, first of all, the completion, then we had the question type, then we have the negative type, and this is community oral health. Community oral health will have the same type of questions, but I just put it here so you can have a better understanding of what a community oral health case study looks like. And we had a question earlier of whether StudentRDH has case studies, and we have community oral health case studies like that inside community oral health chapter, okay? So go find them. Now, this is like that. This is literally a screenshot from the guideline, okay? I just wanted to show you exactly what they had, but at StudentRDH, we have our own sets of questions. So it goes like this, you know, they're this coal mining company and close, so the unemployment rate is really high, and the average population is 46, and there's 3 dental clinics or things like that. And then as a dental hygienist, you go to the kindergarten students and you take their DEFT score. And then, you know, they talk about the fluoride situation in the community. So then you have a set of questions over here. There are about 5 questions per case study, give and take, okay? And it asks about different things, such as, you know, according to the DEFT, so they don't say that, but number 4, let's look at that. It says, what can be stated about the DEFT scores of the kindergarten students? So you look at the DEFT and you say D is 1, E is about 0.87, F is 4.22. That means there are a lot of filled teeth, you know, that's the average, a lot of filled teeth versus D's for decay. So what does that mean actually? So you have to interpret it. That is all about community, right? Community questions are like that. You have to interpret it versus when you have session 1. Session 1 is all about straightforward answer. It's like, when you see this lesion, do you think this is this or that? Well, of course, sometimes it's like, which one is the best answer? When it comes to community oral health, well, we're really left with our analytical thinking, because a lot of things can make sense. So When we look at question number 4 again, if I may go back to that, when I think about this one, there's a high F score, high filled score, meaning actually then the patient had the treatment they needed. Okay, so early exfoliation, there's no indication of exfoliation in the entire case study over here. High decay rate. If D was high, then I would choose the answer, but D is not high. D is actually 1, and filled is actually 4. So if you think about a child math, let's say 1 is decayed and 4 is filled, meaning the patient actually got the treatment they needed, and there's no indication about eruption pattern. So do you start to understand kind of what a community oral health case study can look like? Any questions over here? So please, again, study community oral health a lot, because that's about 12% of session 1. Yes, and Erin, you're saying you understand, but it is still confusing and you still need more practice, right? So what I would encourage you to do is really master the concept of community oral health first. Understand all the DFT score, all the different score, let's say PI, plaque index score, all of that, put that in your brain, memorize it, and then we have a bunch of case studies like this in StudentRDH, so you can actually practice the way you will take the examination. Any questions related to community over here? Any comment? Doesn't have to be a question. You can say, I don't like it, I like it, I'm confident, I'm not, whatever you want over here. Great. Okay, well, and Sindra is saying, unfortunately, our instructor did not teach us much in community oral health this term. Well, Sindra, I'm very sorry for that. Luckily, you can find textbook, you can find StudentRDH, whatever boards review you're studying, but again, memorize it and practice it just the way it is going to be asked for you, okay? Find textbook or boards review that have exactly this format for community oral health, because we can practice 100 different type of questions for community oral health. But if you're thrown this type of question with this specific style, you might not be familiar with it. So you really need to be familiar with this type of question, okay? So great, thank you so much for sharing that with me. Now let's talk about scoring. Aren't you all curious about how does the board examination get scored? When do I get my results? So in the board, in the guideline, it says you will get results weeks, 4 to 6 weeks after your board examination. Now, if I hear from students who've taken the board, they just say it took about 2 weeks or so. So just you log online and see if you have passed or failed. Now, you know, there is no report if you pass. If you pass, it just says pass, that's it. Who cares if you have 80, 75, or 96, right? So you just passed. When you pass the board examination, that's great. However, if you fail, they give you a result with some scores, which is good because it helps you understand, am I weak in case studies? Am I weak in periodontology? So give you a national kind of average and what your score is. So you can compare yourself and find your weakness. Hopefully nobody gets to that point. That's why I don't have an image. Although I have an image, if you really want to see it, email me. I know exactly what the score report looks like, but hopefully nobody will have to ever see it in their life. You just want to pass. Now, some people ask, okay, how is it adjusted? Because 75 is not a hard 75. It's not 75 questions out of 100 questions. Because, so Leanne, you said, I heard 203 correct answers a pass. Is that true? And Leanne, thank you so much for asking me. Can I ask where you read that source? I just want to understand if I have some different information than you have. So yeah, if you can answer that, Leon, that would be great. Okay, so some other students, okay. Well, Leanne, this is what I'm going to tell you today. This is from the board's review guideline, okay? And Carrie, thanks for saying that was not your case. This is from the guideline. I'm not creating this. I'm not inventing this. I'm not interpreting this. I'm saying the way it is, and everybody should know that. It is 75, and let's say your friend, you, and your other friend, they're all going to get different type of questions. Your questions might be the hardest, but because it is the hardest, the board examination is going to say, well, you scored a 60, but that actually translates to a 75, so you might still pass. while your friend scored awesome, but those are all really easy questions. So maybe even an 80 does not even translate to a 75. So as we have some friends saying over here in the chat, they all weighted differently, and each set of question is different. Some people get harder, some people get weaker ones. So that gets taken into account and gets scored. So there's no guideline or anything that says you need 200 or 203 questions correct, okay? So it doesn't work like that. And then also you have to take into account that there are some dummy questions in there. You might have 200 questions in session 1. However, let's say 5 of them were dummy questions. So 5 of them are taken out of the examination. So you actually are graded on 195 questions. Now, I don't know how many dummy questions there are. It depends on the examination. It depends on the set of questions that you will get. So that's why it's hard to say you need just to pass 200 questions or anything like that, okay? I hope this clarifies this a lot. Rochelle, you're asking why there's some dummy questions. It's for them to test certain types of questions or certain types of information, okay? It's for their own use. So, you know, the thing is though is that we will never know if they're dummy questions or not because they look exactly like real questions. Okay, so there's nothing we can do over here. We just have to do our best for every single question. I hope, Leon, that helps you understand how 75 is created. All right. Thank you very much. So let's continue over here. Oh, Heather, you're asking, so at StudentRDH, because we don't have the entire set from every single student, we are just grading kind of, you know, very objectively, saying there's 100 questions. If you have 75, yes, you have a 75 score. Now, that might be a little different than like the scaled one. However, this just gives you a good indication of whether you are on that scale that helps you pass or not. Okay, and previously actually at StudentRDH, what we had is we graded you against the national average. Now we had some complaints about it saying, I don't like to be grading against others. I just want my score. That's why we have taken out that functionality because I think it discouraged some students saying, oh, I'm not doing well enough, you know. So that's why at StudentRDH, we changed that system to be very simple. At StudentRDH also, if you take the mock exam, when you're done, you can see all the questions and their answers and their rationale, so you can study this entire sheet actually, so you can really fully review everything. Okay, and Carrie is saying the first time I got 202 correct and got a 73, the second time I have 202 correct and got a 71. And thank you so much. That's exactly how it is. It's not the number of questions you got correct. It is how it is scaled depending on the type of variation of the exam you had. So thank you, Carrie, for sharing that. And let's make sure you pass this time. And let's just, you know, encourage each other, you know, everybody who is retaking the examination to do better this time so we can all pass. All right, so time, let's talk about time. How much time do you have in the board examination? This is a screenshot of the board's guideline, okay? Now, I thought that was just a little confusing. That's why I rewrote it my own way. So in yellow, you have session 1. In red, you have session 2. Easy, right? Session 1, you have a lunch break, and you have session 2. However, you have to understand that there are different type of the number of questions you have for session 1 and session 2 are different. The time is also different. I wish it was 1 hour, 100 questions or something like that, but it's not. So let's memorize it together. So session 1 is divided into 1-1 and 1-2. We talked about that already. Each one has 100 questions. So it's 100 questions, 15-minute break, 100 questions. Now the 15-minute break is optional, meaning that you can take it or you can say, I want to continue, click. My advice is when you're done with session 1, you submitted your first 100 questions, you take a little break. Just get out, do some jumping jacks, I don't know, just walk up and down the hallway, whatever it takes for you to refresh, because sitting down really actually kills our brain. We don't have enough blood flow. We need some blood pumping in our brain so we can think properly. We need oxygen here. So just do whatever you can to free your mind and then come back. That would be my advice. Take the 15-minute break. And when you can come back, you say start. That's what you're gonna do. So it's an hour 45, 100 questions, 15-minute break, an hour 45, 100 questions, and then you have a lunch break, 30 minutes. Then you come back, you have 2 hours, 75 questions. So case studies are heavier, right? They have photograph, radiograph, patient chart, all of that. So for that reason, they didn't pack as many questions as they would. So that's why they give you less questions, and they give you a little bit more time as well. So instead of 1 hour 45 minutes, they're going to give you 2 hours, a little bit more time, and they're going to give you less questions. Instead of 100 questions, you're going to get 75 questions, and then an optional break, and then 2 hours. Does that make sense now? So I just thought, you know, whatever they wrote was a little confusing. That's why I summarized it again. So, so Michelle, you're saying, I thought session 1 was 250 questions. No, session 1 is 200 questions. Session 2 is 150 questions. Okay. All right. Shazia is asking, Carrie, what boards review did you take for the last 2 exams? So I'll let Carrie answer that. Thank you for participating, guys. Carrie, can I ask which school did you go to? And we're all here trying to support you, okay? It's not just me, it's all the students around you. I hope we can all bring some positivity. Now, we have a question about the optional tutorial. So before you start anything, before you start this, you're gonna get an optional tutorial that's basically help you understand how the computer works. It's a good idea to take it because it just gives you an idea of how you can click, how the mouse functions, and how you can go to the next screen. So you can take it. You don't have to take it if you don't want to, but my advice is why not get some, it's like a warm-up, a free warm-up that you don't even have to be worried about because it's not gonna be graded, okay? All right, so thank you so much for everybody who are talking to each other. We have some other students who are asking about DH seminars. You know, I will let you guys answer each other instead of me, you know, StudentRDH talking about it, okay? Thank you, Carrie, for answering that as well, and everybody who's asking. So if I may, though, the big difference between the live boards review and StudentRDH would be that when you're sitting in the live boards review, it's 3 days and you are kind of supposed to sit there, have a book, and listen to whoever the speaker is. You know, it's a lot. And I don't know, Carrie, what you thought about it, but it's a lot to take in, okay? So it's just, you know, the brain is not supposed to function like that. We don't have 9 hours of 10 hours even more of studying in us every day for 3 days straight. At the end, the brain is fried. It's really hard to understand, comprehend what's going on and memorize it at the same time. So that's why StudentRDH is really go at your own pace. And then with the new package that we have, which is a Success Premium package, you're gonna have videos. So you can replay the videos of me talking about community oral health, me talking about oral pathology, how to memorize oral pathology, for example. Okay, so that would be the big difference. And then in the live boards review, they don't do recordings, so you cannot listen to the lectures after you leave. You only have a book. However, StudentRDH, again, you can replay it. There's some boards review that can help you get the recording, but they charge you extra for that. At StudentRDH with the Success package, we also give you a book because 5,500 of students last year we surveyed said we want a book as well. So we include that as well with our boards review with the Success package. So feel free to ask me any questions. So Gloria, you're asking if there's an app. So StudentRDH is not an app per se, and I'll tell you why. Because doing this type of mock exam on an app is not functioning properly. You have a lot of information. That's why we advise you to do it on the computer. However, you can still study on your mobile phone. So they call it compatible. Okay, this is the technical terminology, that whatever you read on the computer, you can read on your phone, okay? So because the app, you cannot read it on your computer. So that's the difference. If you had an app, you cannot put it on the big screen and have the real experience. So that's what we created for the computer first, and then kind of shrunk it to the mobile size so you can read it while you're commuting or while having your lunch. Okay. All right, yes, Sherry, we will mail you the textbook out in January. Yes, thank you very much for waiting. It has been a little bit of a hassle in, production delay because of the New Year's, but don't worry, I'm on it, okay? All right, thank you everybody for asking all these questions. Now we're towards the end of our webinar here. Now let's talk about what you're going to see in the exam room. Why does it look like that? This is just a nice image. I wish it looked like that, but it's not. But you will have some kind of cubicles, so you will be blocked. And in the room, you will have people from everywhere that are taking the electrician exam. They're taking some nursing exam. It's not just dental hygiene, it's just anybody who is taking that computerized exam, okay? Now, when you are going to the examinations, sorry, there's a typo here. It's not note, but it's like not allowed. So what are you not allowed? You can't bring food and water, even jewelry. They say wedding rings and engagement rings are okay. The rest need to go. Even religious items, okay, extra, I don't know, little things that makes you feel better, you can't have that. But religious attire is allowed, and I totally support that. I'm glad they even put it on the guideline, because nobody should be punished for wearing their religious items, attire at least. Now, even watch, they don't want you to have a watch, okay, guys? So you can leave it at home that day, because you have a timer at the examination. You have a timer right there. And as StudentRDH also, we have a timer for you, just like the board examination. So try that, okay? Phones, obviously you can't have phones. You will have a cubicle, you will need to leave it there. And then you cannot bring your personal earplugs, okay? I have my earplugs all the time when I work. You cannot have that. But they have headphones for you. Now, medical items, let's say you have asthma or things like that, you need permission beforehand, guys. If you think you need some medical drugs, you need to ask them, saying, I'm bringing this for this reason, okay? So think ahead. And then what does the test center provide? Gives you 2 boards. So those are going to be 2 laminated sheets like that and 2 markers. So you can put, let's say, the hypertension guideline, do some quick math if you have to, jot down some notes so you can refresh your memory. And then you can ask for replacements as well. And then they have headphones for you, because sometimes you could be distracted by someone getting up and the fan or whatever that is, okay? Okay, thank you. So Mel, you're saying when asked you want to take a break, remember once you click yes, the timer starts. I did this and the worker didn't come, dismissed me for another 5 minutes, so I came back late and ran out of time in my session because of that. Very frustrating. Wow. Okay, let's recap that together, guys. So Mel, you're saying that oh, I see. So yeah, so when you want to take a break, it's going to ask you, do you want to take a break? And you said yes, right? And you raise your hand because they're supposed to come and get you. You can't just walk out of the room on your own, right? So they come and get you, but they didn't come get you for another 5 minutes. So you actually took your break, but you were taking minutes out of your break because they didn't come get you. I think that's what you're saying. And unfortunately, I'm very sorry that happened to you. I hope that doesn't happen to any one of you over here. But maybe you have to find a clock in the examination room or somewhere else if you don't have your watch saying it was 15-minute optional break, while 5 minutes is out already. I only have 10 minutes left, so I have to come back on time. I need to cut it short, okay? So thanks for sharing that, Mel, your frustration. So none of us have that frustration, hopefully, or if that happens, let's not come back late, okay? Thank you again. Now, lastly, I want to wrap up with, we have studied the guideline. Line by line, I gave you everything you had to know, from question type to how many questions you'll have, to the schedule, to the new guidelines update. Now, that leaves us with well, what am I supposed to do now, right? You can tell me if you don't have any boards review. You can say not yet in the chat room right now. You can tell me I don't think I'm gonna buy anything, or I don't know what to do. Put anything you want in the chat room if you don't have a boards review, and that is okay. My advice for anybody who's preparing, if you have StudentRDH, you know, that's great, thank you, and you're waiting for the book, don't worry, it's gonna come. And you just got your StudentRDH, that's great as well. Anybody who are thinking, who might not know if they're gonna buy it or not, or it doesn't have to be StudentRDH, it might be, you know, another boards review that you wanted to attend. Okay, Eric, you are going to attend DH seminars, great. Great. Can I ask Eric, Erin, what school do you go to in Chicago? So while Harvard, great, thank you. All right, so the ADHA, you're right, has a boards review as well. You know, I don't mean to really talk about other boards review, but it's a little different, okay? You know, I would prefer to have you a full experience than just some questions or some review. So what I'm gonna say is practice with the computer, okay? You know, the live boards review are great, Darby is great, Mosby is great, but then at the end of the day, you have to practice with the computer. I'll tell you why, because the study says that when you are practicing with a computer, or when you're taking a quiz with the computer, the performance is not as great, okay? When you are using your paper and pen, it is pretty good. What does that leave us? That leaves us thinking when you are taking it with the computer, well, you are actually not doing as great. When you're working with your pen and paper and book, you're doing better. So if you just practice with pen and paper and book, when you go to the examination, you're not going to score as high as you used to with the paper, because it's a different format. So that's what the study shows. So I would urge you to just find something that you can have on the computer, okay? So Sunny, you're saying HESI, okay. HESI is good as well. I mean, what they don't exactly do is like do a summary for you or have a real board examination for you. It's more like a lot of practice question, I would say, right? And Shazia, are you in Canada? Are you in Canada, Shazia? No, okay, so Denta L works only for the Canadian boards. She is a Canadian person, and that is very different, okay? Sorry, I'm gonna leave it there. Okay, so find a complete mock exam, that's another thing. So there are a lot of boards review out there, and this is kind of a screenshot on the right side. You can actually buy practice tests from the NBDHE. Isn't that great? However, one caution that I would tell you is that it's not the full examination, it's more like half of it. As you can see, there's only 180 questions for the practice test. You know, if you look at the bottom, that is the full, or not, you pay for different little components and it still end up being $100 or $200. But those are just tests. There's no practice or study guides or anything like that. So what I'm trying to tell you here is that, you know, if you were going to buy something like that, maybe you can put 2 mock exams together, because it's like running the 5K is different than running the full marathon, okay? Doing the half mock exam is not the same thing as doing the full mock exam, okay? So driving 2 hours is not the same as driving 4 hours. Just like that, I want you to just have the full experience if possible, so you understand how your body performs, how your brain performs. And mostly what I want you to do is, I want you to understand if you're going too fast or too slow. Let's say you took the 8 or 9 hour exam and you couldn't even finish, then that means you need to take it a little faster for the next practice. But if you had, let's say, 6 hours left, that means you went a little too fast. So you're really assessing your timing as well, so you can maximize your score. That's how I would like you to do. And again, a lot of boards review have mock exam, but their definition of mock is a little different than what we have. What we consider mock is not like the little portion. Then I can say we have like 30 mock exam, but you know, we have full mock probably that no other boards review have. And it is actually the 9-hour experience. We don't have the optional tutorial. However, we have session 1-1, 1-2, 2-1, and 2-2, just like that, so you can practice it. All right. Thank you, Sharon, for sharing that you like StudentRDH right now. And if you want, here I have a study planner. I can send that to you if you want, which is, I'm just urging you to plan your studying. See, how many days do you have left until your board examination? Count them, 60 days, 90 days, and then write your plan. So this is a planner we have created that's also in StudentRDH in the book. And here you will also be able to find 17 chapters at StudentRDH. So I listed them here like this. And you will, this is the process I would like you to do if you want, okay? Here, confidence, okay, you're just assessing yourself. And then you have quiz 1 score. Now, quiz 1 is for StudentRDH. We just have a set of questions, about 30 questions that can help you understand how you're doing. Let's say you took quiz 1 is 40%, you write it down. Then you had a neg, you did 60, or pathology, you did 70, for example. And then you assess how many days of study do I need. And here, I want you to find your weakness. Which one is the worst? Here, obviously, pharmacology, right? Okay, so pharmacology here is the #1 thing you're gonna start with, not the other one because you're doing great, okay? So do you understand kind of the logic of how we design the specific planner? So you're gonna take pharmacology and you're gonna put it here, unless in January, you're gonna put it here saying, I'm gonna study pharmacology for about 5 days. And then you say the next one would be head and neck anatomy, okay? So if you don't have StudentRDH though, what I want you to do is just go to the back of the book or something, find quizzes that can help you assess what your weaknesses are, okay? You don't need to have just StudentRDH, you can have Darby, whatever you want, but find some quizzes that can help you assess. So quiz 1 at StudentRDH is very much for an assessment. Quiz 2 though is harder than quiz 1. After studying, okay, you do quiz 1, you study, you retake quiz 1, you say, did I do better than I did before? And then you take quiz 2 and you say, can I do even better? So that's kind of the general idea over here. All right. So anybody from Massachusetts here actually, though I know some students are talking about it right now, Cheryl. So the reason why I'm saying that is because I will be there in Massachusetts, March 7th with the Massachusetts Dental Hygiene Association. I'm gonna provide a whole full 4 hours of student session, okay? So it's gonna be a little different than board prep, because board prep, everything is online already with StudentRDH and all the videos, but I'm gonna walk you through the techniques that you can use, some tips to maximize your examination. So if you are participating, if your school is participating in the March 7th event, I will see you there, okay? So Massachusetts Dental Hygiene Association invited me to be there and present to you. So see you really soon if you are in Massachusetts. So we just talked about planning your study as well, okay? And when you plan it, rehearse it in your head that you're gonna be successful. Every day you put some new item on the sheet, know that you can get to the finish line, okay? As much as it is about information, it's a mental game. You know, you need to feel your success already before you arrive to the examination to become successful. And Maddie, I am not exactly sure what that would be in math. It's up to them to decide, okay? Thank you. All right, so that really leaves us with, at the very end, we're at the very end of our webinar. And for those of you who don't have StudentRDH yet, I wanted to provide a discount for the success package that includes the book and the videos included, and the code is Gen2 webinar. Please put that and you will get the $71 discount. All right, so last part is that some students have questions about what's the basic package versus the success premium package. And this is the difference. You know, basic package, we have 15,000 students who pass with the basic package already. It works completely great. You know, a lot of students will tell you you don't even need anything else. But premium upgraded package is because student asked for the book and they wanted videos, so we are giving those to you. With the success package, we have a book shipped to you. You have 6 months of access. You have an extra 300 questions, and every month we're going to meet live, so I can take your answer, okay? Questions, so I can answer live things about head and neck anatomy, things about tips, anything that you want. And we have videos for you to replay, a lot of great resources. And in the videos, I use wake up memory techniques to help you understand, let's say, even the high blood pressure guideline. How can you memorize the different numbers there? Or what about the drugs? How can you memorize the generic name and the brand name? So I make videos for those as well. And thank you everybody for being here now. We're about to end. Anybody has a question? We are January. I'm so impressed by everybody who is here. And Michelle, are you asking that you already have the package or you want to renew after 6 months? Because if you are taking the boards after 6 months from now, let's say in July, you just ask me for free extension. You don't need to renew it at all, okay? You guys, again, you can email me for a free extension. So Chris, if you want to upgrade, send me an email. We have a little code for you and you can upgrade for $50 for you to get the book and to get all the videos, okay? Keely, you're asking about the book setup. So the book is very similar to what you would have, the notes on the online version. If you really want to read it with the book, you have a physical book. We included a lot more pictures in the book as well. So for example, oral pathology, it's a little different as well because we made an entire grid out of it. So you can, we have notes for you. You can make notes as well and have an entire beautiful summary instead of having pages and pages and pages to read. So it is a little different. We designed that based on the students' feedback and recommendations. So I hope you like it. Okay. Mel, do you need proof of reschedule? Mel, it's okay. Just email me. Usually I ask some sort of proof saying, hey, are you graduating a little late or something? But Mel, I know your story already. Just email me and Sinclair, you promised me in the webinar that you would just give me a free extension. So please do that. So Michelle, you're saying I'm planning on taking in the summer. I already have the success package, but I would like to be able to feature the perinatal guideline or no. Okay, so that is actually a really, really like sticky month because summer is going to be like where the changes are going to happen, and they said they're going to release it in the fall. So what we're going to do for our students is that in the transition period, we will have 2 sets of answer for you. It's going to be according to the old guideline. It kind of would look like this, but this is the new guideline as well. So there will be a transition period as well as StudentRDH where we'll have both, so you can understand both just in case, because summer is again the sticky month. We don't know what is going to happen, okay? And Mel, you're saying you haven't rescheduled yet. Yes, it's okay, Mel. We're here to support you. We're not here to just get some more money because you need an extension. We need you to get to the finish line, so email me anytime, okay? Chelsea, you're asking, I'm graduating in May. When do I start studying? Yes, Chelsea, can anybody answer that right now? Like, is the sooner the better to study? What would other students say? Okay, we have Crystal, Michelle, Erin, Morgan, everybody's saying, Shazia, now, everybody's saying, do it now. So that's true. Why wait, right? And actually the beauty of StudentRDH is if you buy it a little earlier, you can use it in your last semester or your last year to prepare for the school examinations as well. I think the summary works amazing as well. All right, Kyria, you're asking, I hear 5 months before you take the boards. I'm not exactly sure what you mean. Can you please clarify, please? Okay. And Kim, you're asking, the book, are they going to be shipped on the 15th or you will receive them on the 15th? Now, Kim, I am so sorry. I can't exactly fully answer that right now. I'm expecting the books to come to me around the 12th, okay? As soon as I have them, they're going to be shipped out. Okay, I'm going to use UPS or whatever method that can get that to you as soon as possible. So I'm sorry I don't have the answer to you right now. BH is asking, how many hours a day should you study? Or is it personal preference? Anybody can have your comment on that. How many hours should you study per day? So in my professional opinion, because I coach thousands of students, and also I speak in front of professors to help them prepare their lessons as well. And Leon is saying 4. To my professional opinion, I would say you can study, let's say, about 4 to 6 hours. The reason I say that, not 8 or 10 or 12 hours, because our brain has a max capacity. Think about the gym. If you go to the gym, would one day of workout give you the best performance, the best condition? No, it's like little by little. A few hours here and there, you're targeting specific muscles, things like that. So that's why I'm saying 4 to 6 hours and break it down. Don't do 4 hours straight. Do 1 hour, take a break, come back, do another hour, take a break. Because when we are taking a break, actually, after studying, our brain is processing this information. It's like when you type in something on the computer, it needs a little bit of time to search it and to spit out the answer. So if you don't take a break, you know, if you just compact too many things in one day, in a few days, for example, just overflowing on information, and you won't actually get all this information in your head. So I would rather have everybody study a little earlier and do little chunks at a time. And Alicia, you're asking me, is that 7 days or 5 days? To me, the answer is it's more important that you schedule your day better than think 5 days or 7 days. If you ask me, I would prefer to spread it over 7 days and make it a little bit more breathable during my day versus 5 days compact. I know it feels like a great accomplishment to sit for like 6 hours or 8 hours. It feels like you did something, but the brain feels something different actually, you know. You might feel that sense of accomplishment, the brain didn't absorb anything. So that's why I say little chunks, please. And Kylie, you're saying, when do you launch the videos? So the videos are already in StudentRDH. You can go watch them if you have the success package. And the live Q&As we're gonna do, we have a schedule every month. So you can participate in them. And also I can record that if you want. All right, Leon is saying every day is the best, and I do agree. What do you suggest the break time to be in between studying, Morgan? Okay, so I'm going to share with you one of my favorite technique of all. It's called the Pomodoro, the tomato technique. It's 25 minutes, 5-minute break, 25-minute or 5-minute break, or 15-minute, 10-minute break, 15-minute, 10-minute break. Does that sound like your classroom schedule? Very similar, right? It's just because you give yourself a specific time to perform at a high level. I mean, no phone, no music, you know, no distraction, please, guys. And then you take your 5-minute break when you go on Facebook, on Instagram, do whatever you want, get your tea, your coffee, and then come back and focus it again. And that's a proven technique that will help millions of people perform better. So that's called the Pomodoro technique. It's 25-5 or 50-minute and 10-minute break. That's really what I would like you to do. All right. So one last question, how do you balance studying for boards and classes? And that's a great question because you still need to go to classes. You still need to prep for the board at the same time, right? So what I would do is really look at your schedule and say, what are the days I can dedicate for boards review? And if you have only, let's say, 1 hour as well, just write it down on your planner. I think the key here is to find those little gaps and say, I can study 2 hours here, 1 hour here, over the weekend, this and that. To give you clarity, to give you the confidence that you are actually studying, that you are doing the right thing, and you know how many days it's going to take you to achieve, let's say, pharmacology. Because if you don't write it on your planner, if you don't calculate how many hours you have left in your schedule to do certain things, then you will feel like you're not doing enough. And that also goes with confidence. You won't have as much confidence as you should when you go to the examination. And how do you balance that when you still have patients to take care for your live boards, clinical boards? Well, I would say be a little generous with yourself. So let's say generally, if you think, I'm going to think pharmacology for 2 hours, I'm going to study for 2 hours, it might take actually a little longer than that. So instead of shortening our time, say I'm going to finish it in 2 hours, be a little bit more generous with your time, okay? Even with your homework, if you feel like you're going to finish your homework in 1 hour, that might actually take 2 hours, right? So I want you to look at your planner, your day, and just really identify how many hours you can have to study. And again, be a little bit more generous with how much time you can use to accomplish a certain goal. If you were not able to attend this webinar, yes, this one is recorded. I will try to send that to you. Are you registered for this webinar at least? Okay. All right, thank you everyone for being here today. Thank you so much. You know, it's January. I feel your energy. You are all really, really, really going to be successful. The reason I say that because you are here January 2nd, that means a lot. That proves how committed you are. You only have about 1, 2, 3, 4, 5 months. I know we have some students who are taking in the summer, but if you are here today, that really proves that you will pass, okay? So thanks for being helpful for one another as well, for answering each other's questions and for participating, okay? I hope you can actually relay this information to everybody. It doesn't have to be someone just a StudentRDH, you know, success is for everybody. Even if you're taking NDBHE seminars, whatever you are, I want you to be successful. Great. Thank you again. And lastly, I would like to ask you guys, if you are using NDRDH or DH seminars, or the school paid for you, I encourage you to go there. Can you please just quickly put on the chat right now which school you're from and what boards review the school paid for, encourage you to go. The reason why I'm asking that is I'm trying to just come up with a plan to help you guys still while you are going to the board examination, and I have contacts almost in every single school. So maybe there's something there that I can do for you guys, even as a webinar format. And for, yeah, Erin, I know we talked about which school you go to. Just please put which boards review you're going to go to and then what school you are going to. And maybe I can help you even further. All right, guys, if you have other questions, though, my email is clairej@studentrdh.com. I literally look at every single email. If something falls through the crack, just say urgent on the line, on the tagline, and I will open it immediately, okay? Thank you, everybody, for even, you know, being here today, listening if you have not participated. And if you, again, can provide some clarity of what kind of boards review you're going to go to and what school you are at, that would be pretty fantastic. All right, so success is with us in 2020, right? I'm not going to let you fail. If you need help, email me before it's too late, okay? Email me before it's too late. Great, so you might leave the room if you want to, and I'm just gonna stay here for another few minutes just to get the chats going and get some last questions. Thank you. Yes, Shazia, thank you. Can you please tell me which school you are going to, and then Amber, which school you are going to as well? Oh, thank you, you already put Pueblo. Perfect, perfect. Yes, perfect. You guys are so kind. I really love this conversation going. And if you, this is what I want from you, okay? I want you to tell me after you attend the webinar, or no, sorry, the live boards review, I want you to just tell me, hey, Claire, I wish it was like this, or I wish StudentRDH did this for us because the live boards review was like that. So I just want some feedback, you know, let's say if the live boards review offered you the recording for like a very expensive price, and I want you to tell me, Claire, I don't have that money. Okay, can you provide me some recording for a cheaper price or something like that? So that's all really what I want to know in order to understand what I can do better for you guys. Yes, Mel, you asked for the private group. I know, right? Okay, so I'm really thinking about that. I talked to our manager and everybody about that. So I will keep you updated, okay? Thank you for the suggestions. Yeah, I love suggestions because that's exactly how we grow, by listening to you guys. All right, so again, if you have questions, my email is clairej@studentrdh.com. And then, I mean, GWell, for example, you paid for your live boards review. I know there are some additional costs with that, which is probably some hotel fees and transportation. And that's why we're trying to do better at StudentRDH, so you don't actually have to pay for all of that, but study in the comfort of your own home. But I know not everybody understands this concept of like online learning. So it's okay. I want you to have the greatest experience. And if you need a free trial or the study planner that's also free, or some tools that we have at StudentRDH that we can share with you for free, please let me know, okay? All right, so thank you again, guys. I would really encourage you to email me again if you have questions before it's too late. So I'm going to leave you here today. Thank you so much for being here on this January 2nd event, and I wish you lots of success, okay? Bye.